Hello and welcome everyone to a fear-free look at canine noise aversion and feline house soiling. This was rescheduled from May 7th, and we're very grateful to all of you who registered again so that you could attend tonight. And anyone who's here who was going to miss the last one, we'll pretend we did that just for you. I'm Christy Keith, Senior Communications Strategist for Fear-Free. And before I introduce our speakers, I'd like to take care of a couple of quick housekeeping items. This presentation was not submitted for RACE CE. However, if you're looking for CE for fear-free, you can just enter it manually in your CE tracker. And if you have any questions about that, please email wags@fearfreepets.com. Second, yes, the recorded version of this webinar will be available within a few days at fearfreepets.com/webinars. Sometime next week. Because of the holiday, it might take a couple days longer than it normally does. Dr. Tynes and Dr. Learn, now my dogs are going to punctuate this, apologize. Dr. Tynes and Dr. Learn will have time for a couple of questions at the end. But please enter your questions in the Q&A window. Oh, I knew this would happen. I'm so sorry, everyone. I really apologize. Please ask the questions as soon as they occur to you rather than recording them until the end. That really helps us plan our time better. You ask them in the Q&A window, not in the chat. So just make sure you can find that. And it's now my great pleasure to introduce our presenters. Dr. Valarie Tynes is a diplomate of the American College of Veterinary Behaviorists, as well as of the American College of Animal Welfare. She's been part of the Ceva Fear-Free Practice Certification Team and a member of the Fear-Free Speakers Bureau. And of course, she's a Fear-Free certified professional. She's part of our Fear-Free family. Dr. Amy Learn, VMD, graduated from, drumroll, I guess we all know where, the University of Pennsylvania School of Veterinary Medicine. After graduation, she completed an internship in small animal medicine and surgery. She's been practicing general medicine for 14 years and is fear-free and low-stress handling certified. In 2017, she started her residency in clinical behavioral medicine and is co-mentored by Dr. Lisa Radosta in Southern Florida and Dr. Amy Pike in Manassas, Virginia. Thank you for being with us today, Dr. Tynes and Dr. Learn. I'll turn it over to Dr. Tynes now.
All right, thank you very much. And I want to thank everyone who tried to attend last time but was unable to and has hopefully returned for this presentation. So bear with me, I have to share with you a little bit for those that weren't or that missed the last presentation because I had to cancel, and I thought I'd share with you just a couple of little slides to tell you about the excitement that went on at my ranch that night. It's really very much in keeping with the subject of our presentation, which begins with the concept of things that go boom. And this is just how dry it is in West Texas right now. So again, a little bit of a look at what we're dealing with and why when our neighbor called and asked my husband, "Are you burning something?" My husband said, "No, not intentionally," and went to check because the report was that there was smoke from our property, and that's what you see in this picture. The next picture, just again kind of for fun to share with you, this is what happens when lightning strikes a tree. In case none of you have ever seen a tree struck by lightning, it's always quite impressive. And this one is exactly where we discovered the fire began, was when lightning struck this tree. And fortunately, as you'll see in the next slide, it was all's well that ends well, because we really did not have a whole lot of property burned, just a couple of acres. So I just had to share that and thank everyone for the concern. I got so many nice emails and texts from people who were very concerned about me. And it was exciting, but nothing dangerous. So thank you again for joining us for this discussion. Because yes, thunder and lightning go boom and are distressing to our pets, but also the time of year that we are approaching is when other things go boom, such as firecrackers, fireworks, So regardless of where you are in the country, I suspect that you will be potentially dealing with some of these problems in the coming months. So that's why we thought this was very timely. And what I find particularly sad about this problem is that many pet owners tend to not necessarily realize that this is a serious problem for their pet, or they don't really think that they need help for it or they need to do anything for it, because, or at least not until the pet is actually doing something very destructive or vocalizing or house soiling. And sadly, it's those milder signs associated with anxiety that I believe give us the opportunity to do something. So people that have seen these signs in their pets, we can point out that, hey, this is a problem and it will get worse. So let's do something while we can plan ahead for it. Let's do something that can make a difference for the pet and make their life easier on them, and not wait until it becomes this really, really horribly distressing situation. So to begin with, I always like to kind of start these subjects with a little bit of a definition so we all understand exactly what we're talking about. We've used the term noise aversion because truly a lot of dogs do just have mild noise aversions. Aversion by definition is just a description. So basically an individual's uncomfortable about something and then they would maybe avoid it if they could. But anxiety, fear, and phobias also exist when it comes to noises. And that's where I think it helps for people to at least understand that these are each different emotional states. We know that they probably arise from different places in the brain to a great extent. And I think having a good understanding of them is important to dealing with the problem. So by definition, anxiety is just that anticipation of danger or a perceived danger. Now, it's important to be aware that that can be an unknown danger or an imagined danger or a real danger. So kind of a reminder for us who think, oh, silly dog, you don't need to be afraid. We can't tell them not to worry or fear something. If they perceive that something is going to be dangerous to them, then that anticipation causes anxiety. There's nothing we can do to just tell them, don't feel anxious. Fear is an emotional state that really should be adaptive because its purpose, if you will, evolutionarily, is to lead an individual to avoid things that it perceives as dangerous. So this is more something that happens once the danger appears to be present to the individual. And like I said, it should lead to avoidance behaviors. And then hopefully that solves the problem and everything's okay, right? But again, sometimes animals perceive things as scary that they don't have to, and that can be a problem. And what's even sadder is that the phobia often develops when an animal has experienced fear or anxiety repeatedly in a certain situation. The problem can exist on a continuum, and now it can just keep getting worse and worse and worse because of repeated exposure. And we get to a phobia, which by definition is that persistent, excessive fear, usually resulting in responses that are completely out of proportion to the threat that's really posed. So thunderstorms are a great example. I like to talk about why would an animal that is afraid of a thunderstorm go through a plate glass window in their panic? It's going to just put them out into the middle of a thunderstorm, right? That is completely irrational and certainly out of proportion to the threat actually posed. But that's why you get these terribly tragic situations where animals bloody their feet, they break their teeth, or again, I've known of animals that went through glass windows to try to escape this threat that they perceive. So just being aware that these are different responses, that they can appear to exist on a continuum, And worsening of the responses is very, very common. I think the most important thing we want to help our pet owners understand is that when animals are caught up in one of these emotional states, they have no control over their behavior. Those behaviors that people find so frustrating, such as the destruction and the house soiling, that's the animal experience an extreme fight or flight response. Their sympathetic nervous system is in control, and they can't control that behavior themselves. So I use that to try to ask people to have a little bit of empathy and recognize that this is real for the animal. So what can a noise aversion look like? As I said, it could be just, as this video shows here, pacing, panting, salivating, maybe some whining, trembling. Some dogs will attempt to hide. They will often hide behind their owners. But if the owner could check, they would usually see that these animals are experiencing an increased heart rate and respiratory rate. Their blood pressure may go up. All of these things are associated with that animal being under the control of their sympathetic nervous system. Okay, they're extremely distressed, and those are just the mild signs. As I said, if you leave those signs unattended, they will likely get worse, and you may see more severe responses. So the types of aversive sounds that I'm sure many of you are aware, but we do typically see, or I typically see in practice, that dogs will often have a noise phobia that is limited at first to what I can describe as loud percussive noises. So things like storms, fireworks, gunshots. But for many dogs that are really, really noise averse, that seem to have been born that way, if you will, they often have aversion, what is clearly an aversion to any loud noises. So things like loud equipment outdoors, the backfiring of a car, sirens, alarms, doorbells, babies crying, even sometimes something as mild as, or we would think is mild, like the electronic digital alarms in our home. And oftentimes, again, they may start with one or two, but if not treated, they will generalize these fears or phobias to other sounds and again become more sensitive to a variety of sounds.
Valarie, that brings up a good point. I had some strange cases, and one dog became scared of just simply the squeaking of the kitchen drawer and would go into a panic anytime that the owner went into the kitchen and opened those drawers. And the other is back in the day when we had beepers because we were on call. Now, I don't want to date anybody, but I remember that part of my life. And a friend of mine was on call, and her dog would get so stressed every time the beeper went off because she was stressed, right? She didn't want to be on call. And every time the beeper went off, she was worried, and then she had to get up and get all of her stuff and rush out of the house. And so from that point on, the dog learned that every time the beeper went off, chaos happened. And so that dog became afraid of the beeper sound even.
Exactly. And those are great examples, again, that I think a lot of people might think, well, that's no big deal, or that's silly for the dog to be afraid of the squeaking of a drawer. But clearly for that dog, those sounds are aversive. And I think we have to be respectful of that. And I also totally get it. I think I had a bit of a phobia of my beeper, or a bit of a phobic response to my beeper as well when I had to wear one.
I know.
We can relate to that one, I know. But so really, a lot of people ask, well, how common are noise aversions really, right? Like, why should we be spending time talking about this? Well, there have been a variety of different studies that have looked at these, and in both here in the United States and in the UK. And overall, it does appear that it would not be surprising that maybe 40 to 50% of dogs out there are actually averse to some noises or fearful or anxious about some noises. So that's pretty sad. And what several of these studies also showed, when basically another set of of authors came along and looked at all of this, and how one of these studies actually showed that only a third of those dog owners said that they would seek help, and about 15% of those said they would not ask their veterinarian. They would ask, you know, their neighbor or their family member, or Dr. Google, right? And so again, the question has to be, well, what does that really mean for us? Well, I think it's profoundly important to the veterinarian, because what it means, these doctors that put these numbers together and kind of looked at this, they concluded, and it's published in this particular chapter, that for every 3 clients that mention this problem, 17 probably say nothing. So if you're in general practice and you just think about that for a moment, to me, that is not only it means that some dogs are suffering out there and they're not getting care, but it's also lost potential income, if you'll let me just be frank about it, right? Because these are patients that you could be helping, you could be selling something, you can be educating clients, and potentially in the long run keeping this pet in the home. So think about that. For every 3 clients that mention the problem to their veterinarian, 17 of them that see you may have that problem in their pet, and I say absolutely nothing.
I hate to admit it, but I am one of those people. So I'm going to give you a little story since we're talking about this. But a long time ago, in a land far away, before I was even knew anything about behavior or very much about veterinary medicine, I had a shepherd cross that was literally afraid of everything. She was the most anxious dog that I've ever known, and she had certainly had a fear of storms as well. She knew way before I did, and she was panting and pacing and drooling even when the sky started to get dark. The wind picked up; those were the triggers for her. So I just thought, oh, she's a silly dog, and I didn't really think anything about it. But I was wrong, and we'll come back to her a little bit later.
Yes, a perfect example, again, which I think just, you know, we can share with our clients. They shouldn't feel guilty about these problems. It's not their fault, and if they don't know to ask the veterinarian, then of course not, they won't know. So that's why we want to talk about being proactive, right, and encouraging veterinarians to ask these questions. And we're going to come up with, we have an easy tool to help you do that. But when pet owners encounter these problems, they will often, I know in my situation, they often want to know, well, why? Why does my dog have this? You know, what causes these problems? That's important to a lot of people. And I like to get it out there and make it pretty clear that no one really knows why dogs develop any behavior problem, but certainly not why they develop fears of noises or fear of being alone or any of the fear and anxiety related problems they get. What we do suspect is that a lot of things play a role. One of them, of course, being genetics, because fearfulness and shyness are traits that have been shown to be highly heritable. The other thing that has been hypothesized and probably plays some role is the effects of a traumatic experience, especially one that occurs when the animal is still very young. And a dog, for example, in its very critical period of development up until, you know, let's say 4 months of age, we know that they are more sensitive to the long-term negative effects of a frightening experience at that point. So at that, I kind of also sum this all up with, it's a combination of these things: an anxious temperament, which of course is probably genetic, what their early socialization experiences were like. And this is an opportunity to remind people as well that we are learning more and more about what early experiences, what effect early experiences can have on the development of our pets. So intrauterine effects, now we know, can a mother that is extremely stressed while she has puppies in utero, that can result actually in puppies that are more sensitive to learning fearful responses. So there's a lot of different things that can play this role. And I like to take this opportunity to remind people that There was also one study in 2004 when they were initially really looking at the effects of early age gonadectomy. And as I'm sure you all know, there's a lot of debate right now about the pros and cons of spaying and neutering our pets. Well, one of these studies did actually find that there was an increased risk of developing noise phobias associated with the earlier spaying and neutering. And since then, there have also been a couple of more studies that suggest that spayed and neutered animals may have a higher incidence of certain fears than non-spayed and neutered animals. Now, does that mean that spaying and neutering causes dogs to be more fearful or more susceptible to fear and anxiety-related problems? I don't know that we can say that, because what we haven't done is look at the fact that when you spay or neuter these young animals, you are taking them into your clinic a lot of times during this very critical period of time in their development, and they are having a scary experience. So maybe it has nothing to do with the surgery per se, but has everything to do with the experience that these dogs are having in the clinic at this critical period of development. So that leads us to our first fear-free tip number 1.
Oh, I love those.
I hope you will take this little point away. And that is the fact that when you're spaying and neutering these young animals in these situations, when owners decide they want to have them spayed and neutered, even if they're still under a year of age, even if they're adults, we need to think about the experience they are having. Use your low stress handling techniques, use your calming products, your PVPs, your compassionate approach and touch gradient. Use all of the tools that you possibly can to help make these experiences as as non-scary as we possibly can, because it may be that we can help this puppy grow up into a better adjusted adult if we can avoid some of these really frightening experiences at that age. The other question a lot of people ask, well, is there a dog that's more likely to get a noise aversion? Well, interestingly enough, it does appear that certain breeds, such as the herding dogs, and I think one study even found a little higher incidence in some of the hounds, these animals may, in fact, be more likely to get noise aversions than other dogs. And the main thing I want you to keep in mind here, because again, I believe so many other things play a role, but remember that noise aversions also usually develop in the young animal. So before they reach social maturity, which for most dogs is between 2 and 3 years of age. So this can also be a reminder that if you are seeing a client who has a dog that they describe as having a noise aversion, part of the history does need to pursue whether or not it showed early signs as a young dog. Are we truly now seeing a brand new problem in an adult or middle-aged dog, or are we seeing the natural worsening of a problem that I bet is going to, most of the time is going to happen if you don't treat? This problem is going to naturally worsen. And the dog may have been living with it for a long time, but if it's truly a new problem in a middle-aged dog, that's when you want to really think about a medical problem, an underlying medical problem, because it's more likely these dogs will develop these problems while they are still young.
So I have been in general practice for about 17 years now, and I have just recently completed my behavior residency, which allows me to see things from the trenches every day, like you guys do, as well as looking down from the ivory tower, because I have to read lots of literature and textbooks and all of those things. And people say to me, "Oh, Dr. Learn, noise phobias and storm phobias are the same thing, aren't they?" Well, we've already talked about what a noise phobia is. And Valarie explained the difference between anxiety, fear, and phobia. I'm going to use the term phobia moving forward just to simplify things, but a storm phobia is a profound, non-graded, extreme response to some aspect of the storm, the noise, the wind, the lightning, the thunder, even changes in ozone levels or barometric pressure, This manifests as intense avoidance, escape, or anxiety, and is associated with the sympathetic branch of the autonomic nervous system. So storm phobias often evolve from noise phobias. Dogs may start out being afraid of the cracking of thunder or the whipping of wind through the trees. With all of these descriptions, it sounds like we're in a creative writing class, right, Valarie?
Yes.
All right, back on track. So the startle response to these terrifying sounds starts to spread to other signals because the pet anticipates that these signals predict that thunder will occur. So they chain these events together, and therefore the cloudy sky and barometric pressure changes and the wind whipping around can be terrifying because it predicts thunder, which of course everybody knows means imminent death. So when you have a client that is concerned about their dog's response to noises, you should think about some other things just to make sure you know what's going on. Decreased vision, pain, decreased hearing, pain, fear of another stimulus, pain, separation anxiety, pain. I know it seems kind of silly that I said pain multiple times. However, this is really significant. I want you guys to remember this. The literature tells us that many dogs have late onset changes in behavior may have a medical issue. Remember how Valarie talked about looking for medical issues, and that can contribute to the problem. So more specifically, there was a study in 2018 that showed that some dogs developed noise aversions as adults, and they had been found to also suffer from chronic pain like arthritis. The treatment for those dogs was not successful until the pain was treated with some type of analgesic. So it seems like a really weird relationship until you think about how we respond to something that startles us. We flinch, we jump. And if we already have chronic pain, flinching exacerbates this pain. So it makes more sense in that context. Additionally, dogs with noise phobias may also suffer from other anxiety disorders, like separation anxiety or even a generalized anxiety disorder. There's even a study in 2001 that said that there's a high probability that a dog with a noise phobia or a thunderstorm phobia also has separation anxiety. So guess what, Valarie? That brings us to secret fear-free tip number 2. So when one condition is diagnosed, that patient should be screened for other conditions. We want to make sure we know all of the issues that are going on so that our treatment plan works. So this is one tool that we can actually use. The owner, when they're waiting for whatever happens next, they're waiting for somebody to come into the exam room, they can fill out this survey, and then we can use the back of this form to kind of fill in the blanks and see and calculate what their score is and see how severe. Now, this is a survey that's published by Ceva, and you can talk to your representative if you want a copy of that, and that'll help us get some more information and help our pets. But what I really want to do is take us to the nuts and bolts of this part of the lecture. I think about treatment the way I think about constructing a house. I always build a strong foundation. And then, if I need to keep going, I fortify the house. So I use pheromones in most of my behavior cases. Several published studies confirm the efficacy of pheromone use for the treatment of noise aversions. Well, what are pheromones even, really? Adaptol is a synthetic version of the mother's appeasing pheromone that mother dogs secrete around their mammary glands when they're nursing their puppies. Its purpose is to convey the message that the pup is safe and protected and surrounded by motherly love. Who doesn't like that? I mean, that just makes everybody feel good. So another consideration for my anxious patients is polyunsaturated fatty acids. If the patient also has a chronic pain problem, this is a bonus because of the natural anti-inflammatory properties. So that doesn't mean that these things are the silver bullet. For some dogs, this is only the starting point. I always consider 3 things when I'm making my choices. How long has this been going on? How severely affected is this pet? How often does the noise occur? And since you've already gone through the noise aversion survey with the client, you already have the answers that you need to figure out how to help. So the next step that I take in my mild cases is to add in a supplement. 2 that are on my shelf are alpha-casazepine and L-theanine. Alpha-casazepine is a bovine milk protein derivative. The structure is similar to that of GABA, the gamma-aminobutyric acid in the brain, which is an inhibitory neurotransmitter. This mechanism of action is similar to that of benzodiazepines, which are known to reduce anxiety. However, this is helpful because it doesn't have the sedative-like effects that are sometimes associated with benzodiazepines. One study even reported that alpha-casazepine improves the ability of an individual to cope with stress and may reduce anxiety related to behavior in anxious dogs. This ingredient is found most commonly in things like Zilkene, Composure, Royal Canin, Calm Food. So those are some products that you might think about to help some of your anxious pets. The other ingredient that I use is L-theanine. Now, this is an amino acid naturally found in tea plants that is also thought to increase GABA, serotonin, and dopamine levels in specific areas of the brain. A 2015 study found that the use of L-theanine decreases the severity of the dog's global anxiety during storms and reduces the time it takes for the dog to return to baseline. Normal behavior and after the storm ends and diminishes the most commonly reported manifestations of hiding, following people, pacing, panting, trembling, those kinds of things. This ingredient is found in products like Soliquin, Angstine, those kinds of things. So that brings us to the next part of the lecture. We, like good little masons, have built the foundation already. Are you with me? Now, sometimes we have to build a fortress. As with anything, there are some patients that need more support and protection. So next we discuss the pharmacological options, and that includes short-acting and long-acting medications. I'm certain that everyone knows what I mean by situational or short-acting medications, but just in case, I'll give you a little refresher. These medications typically reach a therapeutic effect quickly and wear off after a short duration. Obviously, this varies between classes of drugs. These medications are not meant to be given multiple times a day on a chronic basis, but only to help intermittently with stressful events. So this is important to know because that brings us to what? Secret fear-free tip number 3.
Fear-free tip number 3.
I know. These medications are really good at preventing panic if given with the correct timing. That's the trouble with noises and even storms. They're unpredictable. Many medications need to be given at least 2 hours before a stressful event. And the reason for this is that good old Mr. Adrenaline. Once your sympathetic nervous system is engaged, the adrenaline floods your bloodstream and the medications may not be successful. But let's go over the options that we have. So benzodiazepines work as an agonist of the GABA receptor, which helps to reduce anxiety. These are considered anxiolytic in general, but 2 of them, alprazolam and lorazepam, work near a certain part of the brain called the locus coeruleus, and we'll get to that in a little bit. They have a panxiolytic effect, which means they are medications used to inhibit anxiety or panic. So in summary, benzos can be very useful for dogs that panic in response to a stimulus, and they can work quickly compared to some of the other situational medications, sometimes as quickly as 30 minutes. However, it is important to consider which patients that we use these drugs in, because patients that have severe organ dysfunction or known aggression responses are not good candidates. Benzos can disinhibit aggression, so it is important to understand the medication and all of its effects before using it. So the next class is alpha-2 agonists, and these block the norepinephrine release in the locus coeruleus, I know that fancy part of the brain again, by activating a specific receptor. Just to clarify, the locus coeruleus is a nucleus in the pons, flash back to neuroanatomy, that's in the brainstem, which is the primary site of norepinephrine production. The 2 drugs that we will discuss are clonidine and Cilio. One study on clonidine used for the treatment of fear-based behavior in problem dogs showed that 70% of owners reported improvement. That's pretty good. In Cilio, this is dexmedetomidine, just like the sedative Domitor, but at a very, very low dose. The benefit is that it is absorbed transmucosally and can take effect within 15 to 30 minutes. And because it's a micro dose, it does not cause sedation. Another study of this dexmedetomidine oromucosal gel, and it found that it was an excellent or good treatment effect for 72% of those treated versus 37% of those that received the placebo. So that's pretty good too. Next is our SARIs. These are our serotonin antagonist reuptake inhibitors, most specifically trazodone. Trazodone works because of its complex mechanisms of action that include potent antagonism of the serotonin 2A receptors and weak inhibition of postsynaptic serotonin reuptake. So that's fancy dancy words that do things in your brain, but the most important part of that is that a 2008 study found that trazodone was used as an adjunctive agent in combination with other behavioral drugs, was well tolerated over wide dose range, and enhanced behavioral calming when administered in an as needed basis. Now, if noises are predictable and infrequent, that's fantastic. But if you live in Florida, where I trained, thunder is like being on the Oprah show when there's a giveaway. You get some thunder, and you get some thunder, you get some more thunder, and then there's a hurricane. So that makes it impossible to predict and schedule your medication. In that case, it may be useful to use long-acting medications. And we'll talk more about how to prepare for noises in the next segment. But long-acting medications for fear typically mean a selective serotonin reuptake inhibitor or a tricyclic antidepressant. These are not used with every patient that has a noise aversion, but should be considered for those with anxiety-related comorbidities or for patients that frequently expose to their triggers in such a way that it cannot be anticipated or treated with a situational medication alone. Success has been reported for fluoxetine and clomipramine, just to name some examples. Other drugs that we use include paroxetine and sertraline. How can we improve our patients' responses? We can predict the threat and prepare a safe zone and medicate effectively. Radar is essential for this task. The better prepared we are, the more we can protect our pets. Aside from storm tracking, the 4th of July always falls on the same date, so we always know when fireworks are going to occur. Some countries have even switched to silent fireworks just to spare wildlife and pets from the panic of the celebration, but until the US catches up with that, we just need to think ahead. Now, this year might be different, right? Because it shouldn't be so bad. People aren't gonna gather in large groups and have community fireworks and parades and things like that. We're all stuck inside. Do you think that's gonna be okay, Valarie?
You know, I'd be surprised. I just think of that dog when the firecracker goes off next door. You know, it doesn't matter if it's one firecracker or if it's the great big community show, they're still going to be afraid.
Yeah, right. All it takes is one loud bang. It doesn't have to be an hour.
That's right.
It's scary no matter what. All right, so this brings us to secret fear-free tip number 4. Medication alone does not solve a behavior problem. What else can we do to help these pets, you ask? Well, that's a very good question, and I'm going to tell you. In many cases, pets seek a place that helps them feel better, like the closet, the bathtub, their crate, this cute little chair. I don't even know how that dog fit on there, but certainly he looks really comfortable. So we want to make sure that they have a safe place, which might mean a dark, quiet, den-like space, a comfy bed or blanket to rest, and even an old t-shirt from the owner so it smells comfortable, it smells safe. We can play music or white noise. This decreases the salience or value of the threat, so it doesn't matter so much because you can't hear it as well. We can use that space and condition relaxation there so that the location cues a relaxed response from the pet. One of my favorite resources for this is Dog Nerds. They have a noise aversion class which uses classical conditioning to create a sanctuary space. And so with classical counter conditioning, the fear triggering stimulus like the dark sky, the rain, the thunder is paired with a favorite treat or toy and whether or not the pet is entirely relaxed. This creates a positive association, which means that a dark sky equals cheese or thunder equals hot dogs. And this allows the pet to look forward to something very special when the stimulus develops instead of reacting with fear. If you have a very dedicated owner, you can even try to desensitize and counter condition to the sounds that are scary. And that means if the dog responds with fear to the sound of rain or thunder or any other reproducible noises, you can use a CD or a recording, or, I mean, why do I even say CD? Now we have apps for that. This can work on some noises, but it's not always successful because you can't always exactly replicate those noises. So spring has several factors that are relevant for humans. Love and allergies are in the air. For dogs, thunderstorm season has arrived. And for cats, there are a lot of new feral friends prowling around that might be challenging their territory. So now that we've talked about one of the most common dog issues, it's time to turn our attention to our feline friends.
That's right, and talk about one of the most common feline problems. And I know people may think it's a little odd that we are combining these two subjects, but like you said, these problems with feline house soiling do often occur more commonly in the spring because that's when a lot of cats start roaming. And as we will discuss more in a few minutes, that is one of the common causes of feline urine marking behavior. So let's talk about things that go splash. Just going with our dog theme here, we have an umbrella, but really I use this umbrella to signify that I use the term house soiling or periuria, which literally means urine around. So someone coins that phrase meaning urine outside of or around the box. So that to me is the umbrella term that covers the two most common reasons that that owners will find urine outside of their cat's litter box. And that is urine marking, or what you might call inappropriate elimination or toileting behavior. I even read a paper the other day where they referred to it as latrine behavior. The point is, these are two separate behaviors where urine marking is about the cat leaving a message. Okay? They're trying to communicate something. Whereas that elimination is exactly what it says it is. The bladder is full or the bowels are full. We're not going to talk about defecation outside of the box today because we don't really have time to include that. But basically, they need to go. And so they go in places other than the box. There are distinctive diagnostic criteria associated with these two behaviors. And at least one study has shown that when veterinarians recognize what these diagnostic criteria are, they have a better chance of solving these problems if they treat appropriately for the problem. Because like I said, there are two different problems, two different underlying motivations, and two different causes. So features of urine marking usually include standing, spraying urine on vertical surfaces, as opposed to elimination, which is usually with the cat squatting and urine being applied to horizontal surfaces. The locations are often different with urine marking versus elimination because urine marking, remember, the cat wants to leave a message. So those messages are likely to be out and about in clear, obvious places in the home, or near doorways, or near windows. If a cat is eliminating, most of the time, I find anyway, in my experience, that they want to find a quiet place where nobody's going to bother them. So when people tell me that cats are depositing urine in the bottom of closets or behind furniture, I don't usually think that's urine marking. That sounds to me like a cat that's trying to eliminate. The substrates are also different in these two conditions. And this is sort of my favorite tip. I should have made this a fear-free tip. But I believe that when cats are urine marking, they could care less what the substrate is that they're urine marking on, okay? It can be furnishings, it can be upholstery, it can be curtains, but it could just as likely be linoleum or kitchen appliances. Whereas when cats are eliminating, a very large percentage of them, I find, are looking for absorbent surfaces. So most of the time you can at least say that if they're eliminating outside of the box, they will be using a similar surface for all of the waste deposition. So it's either going to be on things that are absorbent, or maybe it's all on hard surfaces. But what I see is usually some similarity linking those substrates, and it usually has to do with absorbency. The last point that also can be very valuable if your clients are observant and paying attention is that cats that are urine marking are not going to do that scraping, digging, covering motions with their feet. Okay, you don't want to leave a message and then cover it up, right? Or even try to cover it up. Cats that are eliminating, even if they're doing it on hard surfaces or the little bathroom rug, you often see them trying to cover it. So many times when pet owners haven't been able to see the cat do it, if you can ask them about things like that, they will often go, oh yeah, I've noticed that the little rug is often all bunched up in a bunch later. And it's because they've been raking at it. That suggests elimination. Now, are these rules of thumb? Absolutely. And not every cat has read the book. So this is just a guidance for you to start with. Because if you have a cat, let's say, that you think was urine marking and you've been treating him for urine marking for a few weeks, and this is why follow-up is so important. You feel like the owner's done everything you told them to. How rare is that? But the problem still occurs. Well, maybe you need to reassess your diagnosis because, yes, there are zebras, all right? I've known cats that squatted to urine mark, and I have seen cats that stood to eliminate. But that brings us to the big secret fear-free tip number 5. If you have a cat that you think now is actually standing when it's doing this, but it's eliminating, not urine marking, think musculoskeletal disease, because that is something that has appeared, and again, in my experience, several times, not something we've been able to document, but it makes sense that if an animal is uncomfortable squatting, that maybe they won't do it for very long. They can't hold the squat position, and some of these cats will just begin standing to urinate. So again, rules of thumb, but worth keeping in mind and starting with the rules of thumb before you look for zebras. So the first thing we're going to talk about here are what are the most common reasons that cats will eliminate outside of their box. Well, that's where it gets, I think, more complicated, because cats may do this because they have an aversion to a location, like they don't like where the litter box is because it's next to where the dog walks by and sticks his nose in their box. Or it can be because they have an aversion to the substrate. So maybe they've decided they don't like the litter. But they can also choose another location simply because of a preference. Maybe this other location is easier to get to, or they're less likely to be bothered there. Or they prefer the substrate because it's softer and smoother. Think the little bathroom rug. I know those are common targets, or the piled laundry. And, you know, I love this box on the upper right because I want to say, seriously, if you were uncomfortable or you really needed to go, would you really want to go to the trouble of jumping in and out of that box? So remember that people choose litters and boxes oftentimes based on their preference, not the cat. So we need to think about that. And then, of course, well, you know, pain, as we've even already talked about with noise phobias, pain can be a big issue for these poor cats. And that can lead them to not want to get in and out of certain boxes. If the other cats in the home are bullying them, it can make it difficult or uncomfortable for them to get to a box, so they will consider, you know, they will develop an aversion. And of course, last but by no means least, poor husbandry of the box. stinky litter box. I always want to ask my pet owners, if you think you find it unpleasant, how do you think the poor cat feels that has to get in there and walk around in it? And what will challenge you most, I believe, in these cases is the fact that these can often occur at the same time. So it may have started with an aversion. The animal discovered some other location was very nice and preferable, and now you have a preference. So these things can often all combine to create a cat that develops a habit of eliminating elsewhere as opposed to their box.
Good points, good points. So before we can solve a behavior problem, we have to be certain it is a behavior problem. House soiling can involve any disease that causes PUPD or pain on elimination, and specifically FIC and UTIs, right? So we know, we see those all the time. We need to identify the possible medical causes or rule them out. So you guys know the drill: CBC, serum chemistry, thyroid if appropriate, urinalysis, potentially with a culture, and then we might even need to have studies like radiographs or an ultrasound to figure out what's going on. So this meme made me laugh because of the grammar, and so it's nothing, like it's nothing, he owns that skull, or it's nothing, like, oh, that's no big deal. I don't know, either way, it's so perfect. So the key to solving all elimination concerns is to recognize the pattern in the choices that the cat makes about elimination. This tells us what the cat's needs are. So what are the rules for providing litter box? Just like Valarie said, most litter boxes that we use and that are sold in the store are much too small. I wish that I could control the size of these litter boxes, though that might put me out of business. So historically, we pick litter boxes, sizes, and conformation based on human convenience, where we can fit it, what we can put it under, and not what the cat prefers. Studies have shown that the litter box should be 1.5 times the size of the cat. And this is because the most common litter aversions are secondary to the size, location, and cleanliness of the box. Literature also suggests that we should have a litter box for each cat in the home +1. Sometimes that gets to be crazy. If you have 15 cats, you need to have 16 litter boxes. I don't know where you're going to put them all, but we should come up with a better solution, like a kiddie pool. We know that the poor litter box hygiene can be a major turnoff. The literature also tells us that scented litter, poor elimination covering behaviors, and diseases of the urinary tract are significantly associated with elimination problems, and that cats with elimination problems are likely to have covered litter boxes. So we might just have to take the cover off, but that the control cats were more likely to have boxes that were scooped every day. So guess what, Valarie? Secret fear-free tip number 6. This is how we're gonna solve most of the house soiling problems in your practice without much effort or even the thought of medication. All you have to do—
drum roll, please.
Yeah, all you have to do is ask about the number of cats, the number of litter boxes, the size of those boxes, and how often they are cleaned, and abracadabra, or what is it, mischief managed. So be sure that they have enough extra large uncovered boxes to provide easy access for all of the cats, and that they are filled with clumping, dust-free, unscented litter, and then confirm that they are scooped at least daily and fully cleaned each week. Oh, this is one of my favorite pictures. So in multi-cat households, solving the problem may need an extra sprinkle of magic. In nature, cats have defined territories and do not overlap their space very often. So we commonly force cats into artificial situations where they're sharing space with their conspecifics, and they would not have chosen to be friends with those cats. We just shove them all together. This can lead to issues of intercat aggression, which is an entirely separate lecture. However, that can also cause stress around resources like the litter box. So it is ideal to have separate territories based on the group dynamics. And even in small apartments, we can use 3-dimensional space. That's why I love this picture. And how amazing is this room, really? The only thing that this room does not have that it should is some hiding spaces, because some cats need some places to get away from the hubbub. Okay, so feline inappropriate elimination is not typically a medication type problem unless there is a medical problem or an anxiety component. Adjunctive therapies like pheromones can be useful. However, it is important to know that different pheromones send different messages. So I get this a lot, but multi-cat does not mean ultra or extra strength. It's not like just because you have a whole bunch of cats, you get multi-cat because it's really a lot stronger. That's not how it works. Multi-cat is the feline appeasing pheromone, which is similar to how adaptal works. And it provides calm and comfort and alleviates tension and conflict between cats. So I put this in common areas where cats share space. Then Feel Away Classic is the F3 facial pheromone, which makes the environment familiar and secure. This is where they bunt and they rub their face on things. It eliminates the instinctive need to mark their territory. I put these diffusers in areas where the cat chooses their separate territory. You can use these pheromones in the same space. They work together without counteracting each other. Speaking of inter-cat conflict brings up the situation where one cat is preventing the other cat from using the litter box. And so if there is a bully cat that prevents the other cat from reaching the litter box, there may be some other tools that we need. I have used bells on the collar to alert the victim of the bully's location. And I've heard of other behaviorists using cat bibs to slow down the bully and decrease the ability to attack. Now, this is funny. I had to look this up because I had no idea what they were talking about. But these are neoprene bibs, and they were invented to protect wildlife and birds, especially from cat attacks, because it's hard for the cat to stalk their prey and then attack. And if their prey happens to be another cat, then it's equally as difficult to stalk their prey. So it could be useful. Just an idea to put out there.
I love it. Now, we promised you that we would get back to the potential causes for urine marking or spraying behavior. And I think it gets a little bit more straightforward because it almost always boils down to something about the social dynamics in the home or changes in the environment. So it is, again, going to be caused by different things usually than elimination outside of the box. The main point, I guess, I would hope is that if you have treated a cat for elimination outside of the box and that treatment has not worked, as I said earlier, maybe you need to consider that it was urine marking after all. So don't ever hesitate to say, maybe my diagnosis was wrong. Maybe this cat didn't read the book. But changes in the environment, such as additions to the family, human or animal, new furniture, guests coming to visit. Who hasn't had a guest come to visit and your cat pee in their luggage? That's never fun. But the risk of urine marking is likely in scenarios like that. And we've also seen that the risk of urine marking does appear to increase with the number of cats in their home. So those are issues that people need to be aware of that cause the stress that lead to urine marking. All right, the most common cause that we found, at least in one study, is going to be that conflict between cats in the home. So if it's not a multi-cat household, don't forget to ask your clients about cats outside of the home, because who wants to have another strange cat coming up to their window and staring at them? This is often very stressful, distressing to cats, and makes it a huge risk factor for urine marking behavior to develop.
So let's take a look at how we can resolve urine marking. This is going to be very similar to what we've talked about. We want to start easy and then work our way up, but pheromones can help by reducing the need for those cats to mark their territories. We also want to change the environment around. One of the most important resources is management. That focuses on changing the pattern of spraying behavior by altering the stimuli and removing those triggers. I use visual barriers. I want to make sure that they can't see those stray cats looking at them through the window. Oftentimes shades or blinds, but just like this cat, you can sometimes pull the blinds down. So think about using bubble wrap in a pinch, or even window vinyl. You want to change the purpose of the area that's being marked by covering those soiled areas with a scratch post or a food station. Make sure you clean with enzyme cleaners. Make sure that they can't still smell those smells. And then provide separate territories for all of the cats. You could even think about turning the indoor cat to an outdoor cat, or using catios so they do have some outside space. So there are lots of different things to do to try to help those cats manage. Now, this cat might be getting ready for surgery or a pandemic, but either way, neutering can decrease spraying in 90% of male cats if that spraying has only occurred for a short period of time. So another option that we have is surgery. And then that brings us to the psychopharm. For chronic sprayers, we may need to build another fortress. We have seen a lot of published studies on multiple medications. The most effective of those that are commonly used are fluoxetine and clomipramine. Another medication that sometimes we use is buspirone. Previously reported in history, they did use diazepam or Valium. However, we do have to be careful because in some cats that can cause a fatal hepatic necrosis. So we've got to be very careful there. But the dilemma with marking is that there's a high rate of recurrence when medication has been stopped, especially when we do not manage those other triggers. So now that brings us to the point where we can answer any questions that anybody has.
Well, thank you so much. And we have many questions. Unfortunately, we won't be able to get to all of them, but quite a large number of them were on the same theme, which was asking you to clarify more both the guidance on the size of the litter box, and also, is there any supporting evidence for that guidance?
Yes.
Do you want me to go, Amy? It's a great question. I was just going to add, so 1.5 times the size of the cat is a good starting place. But I think what people need to think about when you talk about evidence here is, number one, look at a cat. If you've ever seen a cat eliminating outside, look at how much they reach and rake. And think about that when you look at the size of the little boxes that we give cats to go in. And I know there was one study where they actually looked at this, and it was clear that the cats that were not eliminating in the box were reaching and raking, and they were spending a lot more time at least attempting to cover than when they were going in the box. So it's not, I guess, your most direct evidence, but it's sort of a logical thing, if I can put it that way. Do you have a better way of explaining it,
No,
Amy? Or maybe in your literature you found.
Yeah, there is one. So the study that I typically will cite is 2014 study that was published in the Journal of Veterinary Behavior by Guy et al. And it's specifically about litter box size preferences in the domestic cat. So that's where I pulled that information out. And most of the time I will recommend getting an under the bed sweater box and starting with that size of the box.
That's one of my favorites. That just reminds me, I always think back to Leilani Sung's article where the study they did where they spent hours and hours and hours looking at video of cats eliminating. And, you know, you just have to give credit to somebody that will spend hours and hours of their time watching video of cats eliminating.
That's what residents are.
I thought that, I thought that data was very, very telling. So, hopefully that helped.
Can you define the early spay neuter?
Oh, yeah. Well, in the one study that we quoted, Amy, wasn't that prior to 5 months in that one?
I believe that's true. Let's see.
I think it was. And what I would say about the others that I mentioned a little less specifically, they're newer studies, and I'm pretty sure that they did not specifically find the fear-related issues associated with early spay neutering. So that's why it's a very complex discussion, because not all studies really looked at age, but there are an increasing number of studies out there now that are looking at differences in behavior between populations of dogs that have been spayed versus populations that haven't, or neutered and haven't been, and looking at for and seeing some of these types of changes. So that's why I say, you know, remember that the animals are more at risk from a scary event when they're in that first 4-5 months of their lives, but I don't think we need to limit ourselves to that. I think we need to understand if the first time a dog goes into a veterinary clinic to stay for any period of time, it considers it an extremely terrifying, aversive experience, that may have some profound long-term effects on how it deals or how it copes with scary experiences from other places, if that makes sense. Yeah. So I don't want people to look at it as just specifically associated even with noise fears and phobias.
Yes.
So.
Great, thank you. Do you separate social marking of human items from territorial marking of objects in socially important areas?
I don't. What have you learned, Amy, in your studies?
No, I mean, I think that the concern for the owner is that there's urine on stuff that they don't want urine to be on.
Yeah. I mean, if we could do a study, maybe that there would be some academic interest there, but I still look at the fact that we believe that cats urine mark because they feel threatened about the safety of their home. And so there's even one theory that they are surrounding themselves with this more familiar, you know, odors and pheromones in an attempt to make themselves feel like they're safe here when things external that they don't have any control over are happening. And that's why I say I think that can be, you know, a strange cat or a bullying cat in their home or conflict between cats in their home, or it can be the fact that visitors are happening or occurring. And I bet this has a lot to do with individual personality too, if we again could look at that, or temperament or genetics, and we just haven't done that much on cats in that regard.
I also think the tricky part of that is one of the diagnostic criteria for diagnosing separation anxiety in cats is for that cat to be urinating on the owner's bed. So I do think that you have to gather all of the information as far as when it happened, and you know, all of those factors to make sure you know what you're diagnosing. Yes,
it's a good point. And I don't know, you know, separation anxiety is one of those things we don't know if it's that common in cats. I'm sure it does probably occur, but I think it's one of those things you have to look at as another possibility. And you've got to look at the whole picture.
So with a dog with noise aversion, so this dog has had a paradoxical reaction to alprazolam and Cilio, and fluoxetine had no effect. What would your next step be in treating this dog?
Well, I mean, there could be a lot of factors to take into consideration there. So let me just kind of go back. We have a dog that has a history of noise aversion, and they treated it with alprazolam and Cilio, and the dog had at the same time, or had separate?
The person asking did not specify that. I'm sorry.
Okay, that's okay. That's okay. So I think, you know, you can see paradoxical reactions with benzodiazepines, so that is a little bit tricky, and it would then depend on the dose that you used. And if you have a reaction to one, like alprazolam, you could certainly try a different one, like diazepam, lorazepam, pick another flavor. And you aren't guaranteed to have a paradoxical reaction to that drug. And so that's probably where I would start, not knowing more about, the specific issues that are going on with that pet.
Okay, great. Can you review the different subtypes of feel-away one more time? And I got multiple questions asking for some variation of that.
Sure, absolutely.
Okay. You want me to give it a go?
Valarie, you should take this question.
Yeah, because it's a very common question. A lot of people still don't understand it. And we did kind of have to speed through that there at the end because I realized we were getting a little behind. But again, feel-away multicat is a copy of feline appeasing pheromone. So think of it as feline adaptol. It has limited studies, and the studies that have been done on it show that it is effective at decreasing inter-cat conflict in the home. So that's what it's been looked at, and that's what it's been studied, and that's what it seems to be useful at. Feel-away classic, or the original feel-away, that is a copy of a fraction of the facial pheromone. So it's basically in that lovely milieu that cats are leaving behind every time they rub their face on things in the environment. And it has been suggested, the way I like to describe that is that it is a pheromone that helps tell a cat, this is your safe place. This is where you belong. Okay, so the original studies that looked at the pheromone, that's what they found it to appear to be. And in the studies that have been done, because there's a dozen studies that have been done over the last 20 plus years on the product, essentially show that it helps cats tolerate being in stressful places. So travel, being in the veterinary clinic, when cats are urine marking, all of those types of things. So I'm getting into all that because I hope it helps people see that it's more about location. Feel-away classic is more about helping a cat feel better about the place. Okay, it's saying, oh, no, this isn't a strange place. You're safe here. You don't need to urine mark, or you don't need to panic. As opposed to feel-away multicat, which is more of a socially soothing, socially supporting type of pheromone. Hopefully that helps.
Great, thank you. So one practitioner is asking about saying that she or he is seeing at least 3 cases a day of cats with either blood in their urine or inappropriate urination or both, that this is new since the COVID pandemic, and they're wondering, is this a stress reaction?
You bet. Wow, I would like to talk to that veterinarian. What do you think? I mean, that sounds, doesn't it, like, what we call FIC, or feline interstitial cystitis. I mean, it still goes by a few names. Dr. Buffington wants to call it Pandora syndrome, whatever.
Yep.
I think stress.
I do.
And
why are you home?
Why shouldn't cats be stressed? Exactly. That reminds me of one of my favorite memes where the cat says, why are the servants all of a sudden staying home all day? Right? So, yes, I think it probably is stress. And unfortunately, that it doesn't make it any easier to treat just because we're confident that's what it is. Those situations can be challenging because you have to really try to find out what is the stressor in the situation if you can, and eliminate it if you can. But again, that comes, Dr. Buffington's research shows that multimodal, that what I call multimodal, he has a fancier name for it, but I just consider multimodal therapy. You use pheromones, you make sure that the cats have all the resources they need, you basically treat it from multiple different angles, right? Being sure that you're doing everything you can to decrease the stress in this cat's life.
Well, this is all we have time for. The number of questions that were asked really shows there's a great deal of interest in these topics, which is fantastic information. maybe next time we'll do one on each of them. Because this,
Well, and if I may, Christy, Ceva actually has a free online module on house soiling. Not that I wouldn't love to come and talk about house soiling, feline house soiling with you again, because it is a favorite subject of mine. But there is a free CE for that if people would like to go check out Ceva Connect. But also I wanted to be sure they know they can contact me, and you can find me on the American College of Veterinary Behaviorists Diplomat site. And I'm always happy to answer questions about these behavior issues, the pheromones, anything like that. That's my job. That's what I do. Glad to do it.
well, that's really great and very gracious. And thank you both so much, Dr. Tynes and Dr. Learn, for being here. We want to thank all of you for coming tonight. We really appreciate you spending this Thursday evening before a long weekend with us. And we also want to extend our great appreciation to Ceva for making this presentation possible. Thanks again, everyone, and please stay safe and remember to care for yourselves as well as everyone else. And we will see you at our next webinar.
Thank you.
Thank you.